So embryos are formed by fusing together egg from the wife and sperm from the husband. And whenever we are not planning to keep the embryo back inside the womb of the mother immediately, we have to store them by freezing them. Any embryo can grow inside the incubator in the embryology lab only up to 5 days. Beyond the 5th day of life, the embryo it needs the uterus or the womb of the mother to survive. So if it has to continue its life beyond 5th day, it needs to be frozen at the stage of a 5-day embryo. Embryos can be frozen at different stages of life, right from the 2nd day to 5th day. So who all we will perform this freezing process? 1. When the patient undergoes IVF for fertility treatment, but because of some reason a fresh embryo transfer is not possible. It can be the stimulation which leads to the risk of ovarian hyperstimulation, which often occurs in patients with polycystic ovaries, or it can be when the lining of the womb is not ready to receive the embryo. For example, there can be abnormalities such as endometrial polyps or thin endometrium, which precludes pregnancy if we do a fresh transfer. So in these cases, we go ahead with freezing of the embryos. Also, sometimes a woman may have surplus embryos. We do a fresh transfer and there are still more embryos remaining. So these embryos can be frozen for future use, and the patient can come back after the delivery, maybe when the child is 1 or 2 years of age. The embryos will be here for the next transfer to plan the next pregnancy. Also, embryo freezing can be done when a woman wants to postpone pregnancy indefinitely. For example, if she wants to complete some milestone in her personal life, or if she wants to undergo certain fitness treatment or treatment of health conditions such as cancers. In those scenarios also, we can make embryos and freeze them for the future use.